CEO report, Michael.
Rotary Marks Foundation, I guess the one big one there is anticipate May 10th. They're going to be holding a golf tournament up at Squaw Valley. So, know anybody that'd be interested in playing in that or sponsoring or anything, let them know that that's going to happen. Community needs, I don't have too much there. Position recruitment, I will say we are up on the contract that we have come to the end of that contract with the company we were working with. So now we've gone out and gotten bids from 2 other companies to start position recruitment again. And Julie and I will sit down sometime this week, look at all 3 of the proposals and select the company that we want to work with moving forward on position recruitment. I will also let you know we are going to be recruiting for a general surgeon as well, because within a year or so, our current general surgeon will be retiring. So our current is visiting a little bit. So he's at least has about a year left, and he's willing to work with us if we still have found anybody. We're going to begin that process as well while we're recruiting. So we'll be recruiting a position for Pecan and a general surgeon for here. Wellness center update, don't have a whole lot there. There's a lot of things going on, but I don't really have anything to report yet. There's a lot of kind of hanging things out there that are working on. I know they met earlier last week, this week, what day is last week. So working on some things there, looking at some pricing on some things as that comes in. High Five Award this month was Rosie, which is Bonnie's assistant in HR. And the big takeaway there is all of our employees, as they're being processed and our new hires are being processed through, they have nothing but great things to say about the process, and Rosie working with them will be processed through. So that kind of exemplifies the customer service we're looking for. So she received the award this month. Facility update. MRI. There's an agenda item we'll take care of later on related to MRI, but I will let you know that we did not finalize the loan with the local bank for the MRI financing over a 5-year period. They were able to beat the interest rates of GE that GE offers, so we've got that done. It's basically a line of credit is the way they set it up, because we pay a percentage when the machine gets here, and we pay a percentage when the machine goes live. So that money is basically sitting there whenever we get ready to use it. So that project is moving forward. The next piece is the SECO. We're finishing up in the application submission for the SECO. That's kind of been we submitted one, it wasn't really what we wanted through TEEPS, so then we backed up and we took another look at the project through E3. E3 is a company that's worked with a lot of rural hospitals or torch and doors. They just did Clifton's facilities. Clifton had nothing but great things to say about the work they did there. So we're in the process of submitting that application, and they're actually coming this week to kind of give us an update. But probably next month we'll be bringing that proposal to you. That's again, it's a 2.5% interest rate loan through the government to replace all of our infrastructure. When we look at it, they'll have a total number for everything, and we can choose where we want to draw the line on that, or do we want to do everything. The bid's going to include chillers, all the AC units, boilers, all the basic infrastructure. Most of the infrastructure for this facility is in excess of 30 years old. Most of the chillers and everything are over 30 years old. So
you're still going to include the switching out to
LED
it
will include,
and all that?
yes, it will include the lighting as well as part of that. The way the SECO program works is it's a 15-year note, and the company has to, through engineers, and have to prove that over that 15-year period that we would have a savings of greater than the loan amount. We're looking at about between $4 and $4.5 million for everything, but they've got to prove that over a 15-year period that we would save that much electricity and repair costs. And I will say our repair costs are significant. Just through one company alone for CEC for the air conditioners, I think last year we spent $110,000 in AC repairs. So when you start looking at a loan payment versus having, new equipment with warranties and things like that. But we'll have that discussion at a later date, but I just want to keep y'all kind of abreast as to where we're headed with that. That'll be coming soon. We've got urology. Dr. Hyder did come to med staff this last week. And then we're working on just getting his credentialing. Credentialing has been done, but credentialed with the providers, or in other words, Blue Cross, United Healthcare, all the insurance companies. We're working on getting all of that done, so that's what's taking a little while. But the anticipation is that will start in April. We're going to start out one day a month. I think that will quickly grow to 1 day a week. There's probably volume, if not even more than that. I think there's some and the long-term goal we would look at is possibly having a mid-level whole clinic all day and having Dr. Hyder do surgery all day, the days that he's here. So we'll see how that hopefully will grow. We did meet with a new cardiology group that's looking to start holding clinic here. We visited Dr. Miller. As you know, Dr. Miller's full and very busy. So there's additional volume there that we could pick up by having an additional group. This group's more out of Waco, so anybody full service cardiology group, for the most part. So I think we've had good luck in what little interaction we've had with them so far. EHR update. I finally have a finalized contract, all 77 pages of it, and then some. I will be reviewing that today and most likely signing that. It has been through Kevin Reed's office and the attorneys and everything, and everybody, they're happy with the product that we have now. It's taken them about a month back and forth. So we will be finalizing that, signing it, and sending it in. At that point, we will start to get a calendar of kind of how that implementation over the next year is going to take place. So looking forward to that somewhat. An implementation is there's going to be a lot of man hours burned, a lot of late nights as we get ready to go live on that. The department directors especially, they got to maintain their current workload, and they're going to have substantial additional workload placed on them during that process. But the good thing is we're not at a very strict timeline. We do have time where we can make sure that we do a proper implementation, and that's what's important, because we have to live with it. And so that will begin here pretty soon. The first part of it is just data send. We'll be sending them a ton of data for them to start building out the system. So then it'll be quiet for a few months, and then they will actually come on site and start testing and a bunch of stuff. So it's probably a 9-month to a year process. I am happy to say we have actually made an offer, and it was accepted for a CFO candidate. Joe Braddock has worked at a hospital, rural hospital in the Panhandle for about 5 years, has significant small critical access and PPS hospital experience. I think he's been in the healthcare industry since the mid to early 90s. So has a lot of experience. Hospital he was at last did a conversion from CPSI to Meditech, so he's familiar with Meditech and CPSI, and familiar with going through that conversion process. So he kind of what narrowed our choice down is he did seem very strong from a financial perspective on accounting and things like that. So
Michael, when we recruited the last CFO, I remember discussion of his saying that he could help us, a good CFO could help us increase our bottom line considerably. Do you have a feel for this fellow and his ability to do that for us?
I think that's there. In addition to that, a new EHR system will help with that as well, with billing and things and denials. And I mean, the cleaner the system, the more it checks the claims and make sure we're sending out good, clean claims from them. Will increase with that. But yeah, I think he has a lot to bring to the table. He's familiar about PPSA, critical access. So if we if we do make that conversion, he's worked on both sides of it, he's familiar with the building and the accounting on both sides. And it is two kind of different roles with critical access versus DPS. So, and then Roger's not going anywhere. We'll keep him around. You know, my intent would be to keep Roger around on a consulting basis with the conversion, with all the accounting. There's plenty of projects that we might not be here as much, but I would like to keep him around some to work on some special projects and things like that. So we do have a new controller starting next week too. She's locally, lives in Stephenville, currently working at MHMR facility in Granbury. Has a really good background. She's got a master's degree. She's finishing her CPA. I think her long-term ambition is probably to work her way into a CFO role. So I think we got a perfect setup with a CFO to help bring her along.
Do these two positions, their compensation, if you will, does it fit right into where we've already budgeted, or do we have to make adjustments there?
I would say it fits in, in a good way. It fits in. We didn't have to do anything more. We were actually in good shape there. So.
Okay.
One thing I wanted to kind of start y'all thinking about, we'll have a meeting in March, so the March board meeting I'll have a little more to bring. But we would ask the board maybe to think about, as y'all are aware, we have a solar eclipse coming up on April 8th. And the amount in influx of people into the community during that period is, I spoke with Alan, who had a long meeting with DPS, and then there's going to be another meeting in March. They're talking about opening the EOC, or the Emergency Operations Center, for the county. A number of counties have already declared a disaster declaration to be able to activate their different stuff. They're expecting about 1 million to 1.5 million people to be influxed into this. From what I understand, all the hotels, all the Airbnbs, everything in this county is already full for that period of time. So where we might need help on that day, if the board is interested, is working the parking lots and making sure that people coming into the parking lots, if they're a patient, you know, we let them in, but if they're coming our fear is they're going to fill up all of our parking places to sit and watch the eclipse because they have nowhere else to go, and then our patients can't get in and out of the parking lot to be able to. I did hear one the other day, I don't know if you're familiar with the outlet mall in Hillsborough, but they sold out parking places for $50 a piece, and they completely sold out that entire.
Hey, we can make some money.
I've got Tammy working on that on a side note, so if you know anybody that has a big parking lot somewhere in the path of the eclipse, that we could borrow and sell spots to a wellness center. But
How wide, does anybody,
Spill the dreams.
does anybody know how wide the total eclipse path is? I mean,
It's a
apparently
small-
we're right in it, right?
yes, we're right in the path, and it's a small, even I think the majority of the Metroplex is not going to be in it. It's just a little
It
bit.
swings more towards it swings more towards Dallas. The western side of the Metroplex will not be at the 100% mark.
Okay.
We're inside the 100% mark. Most of Hood County and most of Erath County is, but Parker County, I don't think it's just a little bit is going to be in that. So
The people are really.
South-
They're
the direct path is just southwest of us, or southeast of us, excuse me.
So it sounds to me like we need to be aware of the available places for these people to go when we turn them around and tell them they can't come into our parking spaces.
Yeah, I mean, I don't know if there's a good option there, but that's just my concern is that day we're gonna be holding clinic, we're gonna be doing surgeries, we've got people coming in, and if we don't have some sort of control mechanism out in the parking lot, we're gonna be completely full with people sitting watching the eclipse and patients can't get in. And, you know, we'll work with maintenance, and we might even, I don't know what our options are of doing a valet service or doing different things during that time to just make sure that our patients get in and get out without having any significant,
Safety.
yeah. So,
Now, the good
and
news is the eclipse only is going to last for about 4 hours.
Yes, it's not.
Long ways to go for 4 minutes.
well, they've already, one of the things that that Alan visited with him, one of the things you can anticipate is having no cell service during that most likely, just because of the influx of people and the tower's not working because they're not. Yeah. So there's a whole list, and like I said, DPS has some pretty significant concerns for the people and I'll get more from the meeting that we had in March, but that's just, we've got 3 maintenance personnel, so trying to keep all the exits and entrances that we have, just if we can, for a period of time, you know, have some help manning and just working on the parking, so.
Maybe put up signs.
So you can put up barricades and just have people there to kind of check.
So, look around for certain things.
What about people with eye problems, you know, not using glasses or whatever like that?
And we will,
Can't drive.
yeah, we will,
We do have ambulances.
we might look and see if we can get, I've seen glasses for sale, you can get, the school has purchased glasses for all the kids, I believe, in the school. A lot of schools are letting class out, so they don't have to deal with the chaos, but,
You can get 48 pair of cardboard glasses for about 50 cents a pair. If you want some nice ones that you can wear over your regular glasses, they'll cost you $3 and they're plastic. They have a special for
we,
Go out with a welder helmet.
Yep.
well, we do work, we don't have as much film, and
Yeah, back in
I
the days.
asked about film and radiology, but Leah said all she has is manual film, and I'm like, we don't need that out in the parking lot. So,